Iron is crucial for life. It helps carry oxygen throughout our bodies, supporting energy production and a robust immune system. However, like a seesaw, balance is key. Too little iron leads to deficiency, but too much can be dangerous, even toxic. This delicate balance is disrupted in many metabolic abnormalities. When iron levels are too high, it can fuel inflammation. Inflammation is a natural process, but chronic inflammation damages tissues and organs. Think of it like a fire alarm going off constantly. Eventually, it causes more harm than good. In the context of infections, iron overload can be particularly problematic. Many viruses and bacteria thrive in iron-rich environments. They need it to replicate and spread, making our bodies their unwilling hosts. Therefore, maintaining healthy iron levels is crucial, especially during infections. It's a balancing act, ensuring we have enough iron to function while preventing it from aiding the very invaders we're trying to fight off. Covid-19, the viral infection caused by the novel coronavirus, has wreaked havoc globally. While the virus itself is the primary culprit, iron overload has emerged as a significant contributor to disease severity. Studies show a strong link between high iron levels and worse COVID-19 outcomes, including hospitalization and death. One way iron overload, hemochromatosis, worsens COVID-19 is by exacerbating inflammation. The virus triggers an inflammatory response in the lungs, which is necessary to fight infection. However, in individuals with iron overload, this inflammatory response goes into overdrive, leading to acute respiratory distress syndrome, a life-threatening condition. Furthermore, iron overload impairs immune function. Our immune system relies on a balance of iron. Too much iron can suppress the activity of our infection-fighting cells, making us more susceptible to the virus and its complications. The symptoms of iron dysregulation in COVID-19 can be subtle but impactful. Fatigue, shortness of breath, and muscle weakness, commonly experienced by COVID-19 patients, can also indicate iron overload. Recognizing these signs is crucial for early intervention and better management of this immune suppression. Iron overload doesn't just fuel inflammation, it can also lead to a specific type of cell death called ferroptosis. Unlike apoptosis, a more controlled form of cell death, ferroptosis is chaotic and inflammatory. It's like a house fire, spreading damage to surrounding cells and tissues. During ferroptosis, iron reacts with oxygen, creating harmful free radicals. These free radicals are unstable molecules that attack cell membranes, causing widespread damage and ultimately cell death. This process plays a role in various diseases including neurodegenerative disorders, heart disease, and even cancer. In the context of COVID-19, ferroptosis contributes to lung injury. The virus infects lung cells, leading to iron overload and triggering ferroptosis. This process releases inflammatory signals, attracting more immune cells to the lungs, further exacerbating inflammation and lung damage. Understanding ferroptosis is crucial for developing targeted therapies. By inhibiting this process, we can potentially reduce inflammation and cell death, improving outcomes for COVID-19 patients and other immune system suppression where ferroptosis plays a role. Section 4. Iron chelators, restoring balance, combating infection. Iron chelators are specific proteins that bind to excess iron in the body, facilitating its removal. They act like magnets, attracting and trapping iron, preventing it from causing further damage. These complex of proteins are traditionally used to treat iron overload disorders like hemochromatosis, but their potential extends far beyond. Research suggests that iron chelators might hold promise in treating viral infections, including COVID-19. By reducing iron availability, these proteins complex can potentially inhibit viral replication and dampen the inflammatory storm associated with severe COVID-19. Moreover, iron chelators have shown antiviral, antifungal, and antimicrobial properties. This broad-spectrum activity makes them attractive candidates for combating various infections caused by metabolic abnormalities. Studies are underway to explore their efficacy against other viruses like HIV, influenza, and hepatitis C. While more research is needed to establish their role in treating viral infections, iron chelators offer a promising avenue for managing iron overload and potentially boosting our body's defenses against infectious invaders. Section 5. Glucoferrin registered trademark, a novel approach to iron management and immune support. Glucoferrin registered trademark is a novel iron sequestering protein chelator that's gaining attention for its potential in managing iron overload and supporting immune function. Derived from bovine colostrum, Glucoferrin registered trademark offers a natural and potentially safer and more effective alternative to traditional iron chelators. Unlike synthetic chelators, Glucoferrin registered trademark selectively binds to free iron and removes it out of the body, leaving essential iron bound to proteins such as hemoglobin untouched. This selective binding reduces the risk of iron depletion, a common side effect of traditional chelators. Glucoferrin registered trademark exhibits antiviral properties by binding to iron, making it unavailable for viral replication. Additionally, it demonstrates immunomodulatory effects, enhancing the activity of natural killer cells, crucial components of our innate immune system. Beyond its antiviral properties, Glucoferrin registered trademark supports gut health. It helps maintain the integrity of the intestinal barrier, preventing leaky gut and reducing inflammation. This is particularly important in COVID-19, where gut dysbiosis is linked to infection severity. While research on Glucoferrin registered trademark is ongoing, preliminary findings suggest its potential in supporting iron balance, boosting immune function, and potentially aiding in the fight against viral infections. Section 6. Conclusion. Maintaining iron balance is a fundamental aspect of overall health. While iron is essential for life, its excess can fuel inflammation, impair immune function, and even trigger cell death. As we continue to battle infectious conditions like COVID-19, understanding the role of iron and exploring novel approaches to manage its levels is crucial. Iron sequestering chelators, particularly those with a favorable safety profile like Glucoferrin registered trademark, offer a promising avenue for restoring iron balance and potentially supporting our defenses against infectious agents.